Donor egg versus surrogacy. People understand that there are lots of third-party reproduction options when you're doing IVF, and amongst them these are donor egg or surrogacy. But there's a lot of confusion between these two, especially for patients who had repeated failed IVF cycles. A lot of the times when an IVF cycle fails, the patient believes the problem is with her uterus, that her uterus did not allow the embryo to implant. And lots of doctors also cause some of this confusion by actually misinforming patients, by telling them things like, oh, your uterus must be hostile to the embryo, which is why it did implant. Or we need to do some immune tests and it's possible that your uterus is rejecting the embryos and that's why it's not implanting. Or that your endometrial receptivity assay is not fine and that's why there's a problem with your uterus. And therefore, they suggest that you do surrogacy, which means we'll put your embryos in another woman's uterus. That sounds extremely tempting because if the problem is with the uterus and you change the uterus by doing a surrogate, then you're going to get pregnant. Very logical, isn't it? Reality is very different. Surrogacy is a great option for lots of IVF clinics to offer because it's a very profitable option. But the reality is it's often not the right option for most patients who failed IVF cycles. And that's because the commonest reason for failure of an IVF cycle is failed embryo implantation. And an implantation process, the endometrium or the uterus is passive. It's the embryo which is active, which means 9 times out of 10, if an embryo doesn't implant, the problem was with the embryo and not with the uterus. How do we know this? Because we can compare pregnancy rates for older women who do IVF with their own eggs and their own uterus as compared to older women who do IVF with donor eggs and their own uterus. And the pregnancy rate with donor egg IVF is much, much higher for these women, which clearly points out that the quality of the embryo, which again depends on the quality of the egg from which that embryo was made, which is what makes a world of a difference. Surrogacy is a great option, but for a very small number of women who need IVF. These are either women whose uterus is surgically absent or which has been irreparably damaged because of severe tuberculous endometritis or those who have Asherman syndrome. Otherwise, for most other women, donor egg has a much higher pregnancy rate. If you're confused and you'd like to find out more, please reach out to me. I'm Dr. Malpani. Our clinic is at www.drmalpani.com and I'm happy to offer you a free second opinion.